Welcome everybody to the class today. I wanted to talk about nipple trauma. We're just going to kind of get right into it. I know sometimes my videos could be a little long, so I'm going to try to keep them short and sweet and just talk about the topics that are important. So again, welcome to the class today. If you have not hit the subscribe button, please do so. And the little notification bell next to this is a subscribe button. That will let you know whenever I put a video out. There should be somewhere on the screen a subscribe button that you can click, and that will subscribe you. Being subscribed does not cost anything. It just allows me to be in your feed, your YouTube feed, so that when I do have a new video, you see it popped up there. And then if you hit the notification bell, that will send you an alert. Either it can send a notification over your phone or your computer, or it can be sent by email. You decide if you want every single video notified or if you just want a few notified. But being subscribed helps me out and it helps you out. So let's get into talking about nipple trauma. Let's first talk about the contributing factors of nipple trauma. Number one is engorgement. So engorgement can happen anywhere from day 3 to day 5. And then in that first week to 2 weeks, you could experience engorgement, leaking, that kind of thing. And when you're engorged, when your breasts are really full, it's really hard for the baby to latch. And so a lot of times, just that one day of being extremely full and the baby latched incorrectly can cause some nipple damage. I'll put in the link below things that can help you avoid nipple trauma and things that you can read on your own. I've always done that with my videos. I will continue to do that with my videos, and I'll make sure that they're in that in the description, just so that if you are suffering from nipple trauma and you figured out one of these is the reason why, then you can go and read further on it, how you can treat it. But I'll give you little bits of things that you can do. And number one is breastfeeding a lot. So when your milk first comes in, what they say at day 3 to 5, you will be full. And you don't necessarily want to empty your breast at that point. You're going to be a little uncomfortable. You can do things to help with the discomfort. Warm or cold cloth, warm or cool shower. You can lay cabbage leaves, not too long, not too much, but just a little bit to just kind of bring the inflammation down. You can take an anti-inflammatory to help with inflammation. Those are things that you can do to help with engorgement in the very beginning. Now, after your milk increases or your milk comes in, the only time you're going to feel engorgement is when you're missing feeds. So if you find, or if the baby has an ineffective latch and is not emptying the breast, then you can find that you will have engorgement. So that is not normal after, I'm going to say after 1 week, depending on when your milk increases. If it comes in at 3, then day 3, then you should by 7 days be good. Your milk should be somewhat stable. If it comes in day 5, it might be a little over a week where it'll finally be, your body will finally be making the amount that your baby needs and how often your baby needs it. So your milk, I've talked about this so many times, but your milk comes in. So during engorgement, if you latch the baby and the baby is struggling with latch and they only get the nipple, you are going to experience nipple trauma. Let's move on. Inverted dimpled nipples. So this is usually like when your nipple is inverted inside, and when if you use a pump, a lot of times it pulls the nipple out. This is not a flat nipple. This is an inverted, so the nipple is kind of inside. And so by using a pump, sometimes hand expression, and if you get the baby on far enough, then they'll be able to, where they press on the the breast, you will see that they actually will pull that nipple right out and into their mouth. So sometimes with inverted nipples or flat nipples, you can find that the baby again struggles with latching. If the little things mentioned, again, I do have a video on it. You can check my videos. If you do have inverted nipples, there are little things out there that you can use to kind of help bring the nipple out. So you could do some research on that and find out what some of those things are. I know you can use it. I would suggest a manual pump. I wouldn't suggest necessarily an electric one, but just a manual one or hand expression. Sometimes the manual, once it's pulling at the nipple stays out long enough for you to latch the baby. You have to remember that you're not nipple feeding. And so if inverted nipples or engorgement is a problem, then the baby is not going to latch correctly. So you have to soften that breast enough for the baby to get as much breast in their mouth as possible. I always say this. Breastfeeding means breastfeeding. It means they're on the breast. If it was nipple feeding, we would call it nipple feeding, but it's not nipple feeding, it's breastfeeding. It means they have to have as much breast in their mouth as possible in order for them to be effective at pulling that milk out. So an inverted or flat nipple, this can cause some trauma when the baby is not latching like they're supposed to. So there are little things that you can do. And again, like I said, I do have videos on it, talking about it, and some of those videos have information links. And if I remember, I'll be sure to put some links in for you regarding these. The next one is an early use of pacifiers or artificial nipples. So bottles, pacifiers. There's nothing wrong with using a pacifier, but if you notice your baby is struggling with latch, you want to avoid them. You want to avoid all artificial nipples. If you have flat or inverted nipples, you definitely do not want to start off with a bottle nipple or stick in their mouth full of a nipple of a pacifier, because that's what they're going to expect in their mouth. So you kind of want to avoid all of that until you and the baby are good at breastfeeding, and then you can introduce your pacifiers. And if you have to introduce a bottle, usually we say about a month before you introduce a bottle. But if you you're going back to work or something and it's going to be sooner than that, then just try. A month is when your milk is established. So it can take up to 2 weeks for the baby. It can take up to 4 weeks for the baby to actually get good at breastfeeding, because they have to learn how to suck, swallow, and breathe at the same time. So every baby is different, how long it takes them. Some get on and like that, they got it. But others, it takes them a little longer. So you can experience some nipple trauma, because if they're so used to an artificial nipple, as soon as they feel the breast, they're just not going to latch correctly. If your nipple is not flat or inverted, but it's not as long or as big as a nipple of a pacifier or a bottle, as soon as that gets in their mouth, the feel of it, they don't like it, and they get upset because they think that the food is supposed to come from a different source. So stay away from those things if you notice baby's trouble latching. But if you've noticed some latching issues and you've been using pacifiers and you notice some nipple soreness or trauma, this could be because they're trying to suck you the way they suck a bottle or pacifier, and that is not good for your nipples. A short frenulum, unusual palate, receding chin, those are all kind of, to me, they all fall under, there's something anatomically wrong with the baby's mouth, chin, frenulum, anything. It could be tongue, their tongue is tied. So if you're finding that everything is good, like the baby's latched correctly, things go pretty well, but all of a sudden you're finding yourself with some nipple soreness, you might want to look at the fact, look at their chin, look at their tongue, look at their frenulum, and if you need to, you can have the pediatrician take a look at those things. If you're noticing that, the baby is maybe struggling, or maybe not, you don't understand why you have the sore nipples, sometimes it could be because of a tongue tie. So that's just something to consider. A poor fit. So this is usually, so this is outgrown eventually. But sometimes there are moms that have pretty large nipples, and when the baby is first born, it's really hard for them to latch all of that nipple into their mouth because their mouths are so small. So this will actually resolve itself, soon as they grow, but you are uncomfortable until then. So you want to take really good care of your nipples if this is the case. You want to use the lanolin cream. You want to let your nipples air dry and let the breast milk on the ends of the nipple dry on the ends, because they can help heal. And if you notice that there's any nipple trauma at all, instead of using that breast first when a baby is more aggressive when they're hungry, use that breast last. So say it's your right breast, the nipple is really extremely sore, could be cracked or bleeding. Start with the left so that when the baby does come, if they come to that breast, they're not as aggressive. Another thing you can do is pump that breast out and store the milk. Most babies can get a full feeding on one breast, but if they're not, they still seem hungry, then you can use some other way to feed the baby, but you can pump, some of that milk out so that the baby isn't, they're not continuing to add more trauma to your nipple than what's already there. The next thing is teething or removing the baby from the breast. Now, I've seen so many moms do this, and I probably did it as well when they get on wrong and it's so extremely painful. The first thing you do is pull them off. But when you do that, you're pulling, their suction is pretty tight. And when after a couple of times a day of taking them off that way, your nipple could be very sore. It could be bruised. It could be bleeding just from that constant pull and tug that you were doing by taking the baby off. So you want to put your finger in their mouth. You want to break their suction. Get their mouth open wide enough to pull your breast out. That's how you want to take them off the breast. Typically, if you let a baby breastfeed for as long as possible, they will stop breastfeeding. But if you notice that there's pain while they're breastfeeding and it doesn't go away within 30 seconds to a minute, then you want to take them off and reposition them. If it hurts really bad right away, you can take them off and reposition them. That's just something, because we don't want, I'm telling you, just 24 hours of bad latching and you can be sore for weeks. We don't want that to happen. There are things that you can do, so we're going to talk a little bit about treatments. So I mentioned the lanolin. I'm not going to mention any brand names. I have my favorites, but really, you know, it's for you to figure out what you like, as long as it's pure lanolin, because pure lanolin does protect. You don't have to wash it off. It's safe for the baby. But if you go and buy something with some other things inside of it, you're going to want to wash your breast off, your nipple off. So then there's hydrogel pads. Those are really nice. They're just cooling gel pads that you can stick on your nipple, inside your bra and between feeds, and it's just got a very soothing feeling. So you can do that when you notice a little bit of soreness in your nipple. And actually, that is a really good thing to have on hand, because at some point in your breastfeeding time, you may experience sore nipples, and that gel pad is going to come in handy. The next thing is some antibiotic ointments, or maybe because there's a combination of ointments, say if they have thrush, which is a infection or like a bacterial infection in the mouth. It's sort of like a yeast infection, but it's in the mouth. So you might have to take some antibiotics for that, because if that... All right, another interruption. Sorry about that. So we were talking about things that you can do to treat nipple trauma, and we were talking about thrush. Let's see. Yeah, that you might need to take antibiotic. Now, this is the area where if you're taking an oral antibiotic or a topical antibiotic, usually they'll give you both, combination of both. That's where you most likely need to wipe off your nipple before you breastfeed. But you can also you can put on lanolin right before you breastfeed, just so that it kind of adds it like a barrier to protect it. But if your if your nipples are extremely sore, I don't really want you putting the baby on there during, like, if it's you can literally see it's slice. You can see that it's cut open, and if it's extremely painful to breastfeed, even when they're latched correctly, then I would prefer you to pump and say, give the baby through a bottle, medicine drop, or whatever it is. Hopefully the baby is doing pretty good with breastfeeding, that it won't be a confusion for them. But that's what I would rather see you do, and to give it time to heal. Usually within 24 to 48 hours, if you just treat your nipple and don't put the baby on there at all, it'll get better. And the reason I say I don't really wouldn't want you to breastfeed when there's damage to your nipple is, first of all, the damage that it does to you, because even mentally you become where you dread it. I have 4, and I've only once had sore, cracked, bleeding nipples. My first 3, I never had that problem, but with my last, I did. And she was probably the smallest of all my kids. So I think she just wasn't latching very well. And I remember crying and like grabbing hold of the table or wherever I was, and I was in an extreme amount of pain, but I did not want to stop. And it did clear up, but it took a little longer because I was continuing to breastfeed. So that's like, I don't want you to get to a point where you're dreading breastfeeding. I would rather you just pump for a couple of days to get that milk out, to allow that nipple to heal, than for you to sit there and struggle through and it just gets worse. So definitely check with your doctor if it's not clearing up. If you notice some white like under the lip, so it would be like in this area, it's on their tongue, it could be on the sides of their mouth. So if you see white patches and it doesn't come off, it doesn't rub off, and you know it's not milk, then just take the baby to the doctor and they can give you antibiotic, and they'll most likely give the baby an antibiotic too. So that's something to think about, you know, as a treatment, is that sometimes if nothing else is working, you want to go to the doctor and make sure that it's not something more serious where you would need an antibiotic. So treatments that are not recommended is drying techniques. Now, I always say you want to allow your nipples to air dry. You don't want to keep moisture in between you and your bra, the nipple and the bra, because that just kind of like adds. But if your nipple is already raw, I want to say, and it's already it's very, I don't know the word I'm trying to, it's trauma, a lot of trauma to that nipple, then having something wet there is actually more soothing, and it allows it to dry better. And if you just like let the air, but drying techniques, like they mean like a blow dryer or some other form of drying it out, maybe patting it, but you're patting it too hard. We want to leave moisture on an open sore. You have to think of it as like wound care. Like if it was a burn and it's raw skin, the best thing you can do is to keep it moist so that it can continue to grow. Now, it's also good to let it air, so that let the air get to it, so that it gets better. But think of it like this: if you were to constantly dry it out and not allow the moisture there, every single time you would breastfeed, there would be a scab, and the scab would come off, and it would be painful. Whereas if you allow the moisture, the wound care type of, treatment, then you're going to see that it's going to be much more comfortable, and when it actually heals, it heals well. So that's what they mean by not using drying techniques. If you do not have nipple trauma, you do want to keep your nipples dry, not a blow dryer, just letting them air dry. You know, those first few weeks, all we're doing is breastfeeding anyway. So wear something where your breast can be loose. Maybe you have a nursing bra on, but you leave the flaps open for a few minutes until it's completely dry, and then you close up. You can be using gel pads, all of those things as well. Nipple shields, vitamin E oil, vegetable oils, and other over-the-counter nipple creams and ointments. These are not recommended when you are experiencing actual trauma to the nipple. So when there's actual wound on the nipple, when it's broke open, it's bleeding, whatever the case may be, you don't want to do these things mentioned. Now, nipple shields are something altogether different, and you would want a CLC or an IBCLC or a peer counselor, someone of that background of lactation care, to be able to tell you that you need a nipple shield, because nipple shields can be great and they can be horrible. It could be horrible to break your baby off of a nipple shield. It can be horrible when it dries up your milk. There's a system in using a nipple shield. There's a way that you want to use it so it doesn't have the bad effects. And usually, like myself, an IBCLC, breastfeeding peer counselor, we know how to use that nipple shield in a way that, and you want somebody who is overseeing the care of that nipple shield. So you're kind of like talking to them on a regular basis, and it has to be a big need. So you don't want to use nipple shields unless you absolutely have to, and unless an IBCLC, a peer counselor, or a CLC like myself would tell you that you should. And I've had moms do it. A lot of it is because of latch problems, though, not due to nipple trauma. Possible complications from broken skin. So when there is broken skin, it is cracked and bleeding. You have higher chance for bacterial infections. You have a higher chance of thrush and mastitis. Mastitis is like the worst that's probably like the worst fear you have, because everybody tells you there are horror stories of mastitis. Mastitis would be if you have a lump. It's a plug duct basically that turned into infection because you didn't get the milk out. So mastitis happens when you're getting frequent plug ducts and they're not being emptied, and a lot of times plug ducts are due to baby not emptying the breast properly. So if you know that your baby is ineffective at breastfeeding, maybe they don't latch well, and you know that there's an actual problem, you might want to consider a hand expression or pumping after a feed in order for you to know that the baby is okay, the baby's getting enough, and you're avoiding mastitis and plug ducts. So that is something important. If you know the baby is struggling, you want to avoid plug ducts and mastitis. You want to make sure you empty that your breast is empty after the baby feeds. Strategies to prevent complications is to wash the affected area daily with a gentle, non-antibacterial soap and warm water. Talk to your doctor about applying a thin layer of topical over-the-counter or prescribed antibiotic ointment after feedings, such as Bactroben or polysporin, or a combined ointment which includes an antibiotic, antifungal, and an anti-inflammatory ingredients. So this would be more after you've tried things and it's not working. If anything, it's getting worse, you want to go to the doctor and have them look at it, make sure that it's not a bacterial infection or thrush, and then they can sometimes give you something to help it heal quicker, and that's something that you would put on after you feed, and you would have to make sure that it's not on there when the baby feeds. The other thing is washing that affected area. Typically, you do not have to wash your nipples, but in a case like this, you do want to keep it clean. And I would say you use something like a sponge, sort of like sponge bathing, nothing hard. You would just kind of want to tap that area with some warm water and some soap. But like they said, not antibacterial soap, just regular plain soap. You want to rinse it and keep it cool and then allow it to dry. And then, the baby you can get the baby on. If you're experiencing nipple trauma, I really, really can't stress enough that you talk to someone like myself, a CLC, or an IBCLC, or a breastfeeding peer counselor, or if you're with WIC, someone that specializes in breastfeeding there. It could be a number of people that are, but they need to be a lactation specialist. So they need to know and be experienced, and that's something that you want to reach out for. So that is it for the video today. I think it ended up being as long as all my other videos. I apologize for that. I tried to get as much information out as quickly as possible without being too fast. So hopefully this answered any questions you might have. If you are experiencing nipple trauma, if you are experiencing nipple pain, that these are things that you can look at to avoid it if you don't have it yet, or how to treat it if you do. Thank you guys for watching. Again, don't forget to hit the subscribe button, and I will see you guys in my next video. Bye, guys.